Endometriosis is a condition that affects 1 in 10 Australian women. It tends to become more common in our late 30s and early 40s, especially if we haven't had children. It is a condition that is fueled by estrogen levels. However, I must say that the cause of endometriosis is still poorly understood. We have a few different theories that we consider to be the cause, but the most common one is where most of our menstruation comes out each month and comes away from the body. However, some of the blood backflows through our tubes into the pelvis. Normally, your macrophages and mast cells will clean that all up, ready for the following month. However, in patients who develop endometriosis, it is usually a genetic predisposition to this inflammatory condition that causes those deposits to stick around the pelvis and actually form nodules in the covering of your organs around the uterus, bladder or bowel. It can also grow as chocolate cysts in the ovaries. It can affect the covering of the tubes as well as the tubal patency. And all of this can then cause new nerves to develop and increase pain in the pelvis, as well as cause an inflammatory environment, which can affect fertility. And I'll explain a little bit more about that as we go along. With regards to the symptoms, that can also sometimes be less clear. Some women find that they get worsening period pain. So most of us can have some degree of period pain. And usually that occurs for the first 24 hours until there is a good flow of menstruation. Besides that, some women notice irregular spotting. As endometriosis gets more severe and affects the mobility of your pelvic organs, you may find that intercourse becomes painful as well. If you see your gynecologist and we do a few tests, ultrasound scans have become a lot more sensitive and accurate, and therefore can now help us pick up patients that we are suspecting endometriosis in. So not all endometriosis causes infertility. We think that in the initial stages of endometriosis, some people have an inflammatory response to the cytokines and cells that are outside in the pelvis. Therefore, it can cause a toxic environment to the egg that is ovulated out of the ovary, and that can affect the way the egg behaves or fertilizes. It may also affect sperm when it's in that inflammatory environment, and therefore overall affect the embryo created, and then have the possibility of affecting the receptivity of the lining of the uterus, which can then in turn affect implantation. With more media awareness and education around the topic of endometriosis, I think people in general are becoming more aware of their symptoms as well as the possibilities of having the problem. If you are concerned that you may have some of these symptoms or you would like them further investigated, or if you've been trying to have a baby and haven't been successful because endometriosis could be the underlying problem, please feel free to reach out, and your first step is to make an appointment to see one of us, and we can then hopefully quite quickly diagnose the problem, offer you an effective solution, and then guide you through the process that will take you to a successful ending.